My name is Daniel Durand. I'm the Chief Innovation Officer for LifeBridge Health. So when I talk about AI in healthcare, and I'll be talking about it later on today, I tend to talk about deep learning rather than intelligence. We have the newly created capability within the last 10 years or so within image processing and natural language processing for algorithms to sort of iteratively learn and become very smart at diagnosing certain things or extracting certain types of data, whatever, as long as they are trained to do that, typically by a human or a staff of humans that acts as the gold standard for what they're doing, or sometimes by another point, like a diagnostic endpoint, like a biopsy, for example. They can be trained to do certain things, but I think you have to realize that they are deep learning algorithms currently. I think folks watched Watson compete on Jeopardy and they think that that's sort of a real functioning system. And without taking anything away from IBM, I think what we've learned is if Watson was really that generally intelligent as it appeared 5 years ago on Jeopardy, certainly it would be answering medical student level questions in a clinic today. But it hasn't turned out to be that simple, and that's because narrow AI, learning how to do certain tasks extremely well, there's been lots of progress there, but general AI, where you have true intelligence and the ability to make inferences that weren't taught and connect concepts, that really I haven't really seen that in any product or anything that's been offered to me. I'm not a computer scientist, but I haven't seen it. So stated differently, the deep blue algorithm that beat the greatest chess master in history, Garry Kasparov, couldn't beat my 5-year-old at tic-tac-toe because tic-tac-toe is a different game than chess. But even the most mediocre chess player who's any good at it can very quickly pick up tic-tac-toe within 30 seconds if you explain the rules to them, right? And so that's the difference, one of the differences, right, between an algorithm and true intelligence. So I prefer to think of what we have today, a lot of great companies, and IBM Watson is certainly one of the ones leading the pack, right, that have created amazing algorithms that are narrow in their scope of practice, the same way that we have certain healthcare extenders like MAs, etc., that are narrow in their scope of practice when we have them in clinic. And I think the art of this is going to be, how do we stack up enough of these algorithms in the right way that they augment the team, that they help the MA, they help the nurse, they help the physician. And if we do it that way, it's also unlikely that they'll displace any jobs, which is another big part of anxiety around this, that they will augment and make the system more efficient, and we need more efficiency in healthcare. The single biggest reason that healthcare expenditures are expanding and growing relative to other things in the economy is we haven't been able to leverage scale the same way that manufacturing and shipping and other types of technology-oriented services and mechanically oriented services have. And so AI holds the promise of being able to make our workforce much more efficient so that we can deliver more care or better care or more efficient care to the same number of people.